So sometimes you might get negative also.
Yes.
So how do you tackle those conditions?
Patient is getting negative, that time we are not feeling good, but as per scientific way we are going back through the file and we are seeing the history, what is the problem actually patient happened, previous cycle where they did, what happened there also, or here what they did, or our that day 1 to day 5, not only that one, when stimulation started from that day to day 5, our embryo transfer we are observing everything one by one, and where is the problem, whether that is gametes problem, whether that is unexplained problem, male factor, female factor, where is that, we are searching the reason, and if we are getting the reason, then we are suggesting patient ki this problem is there, you go for the this option, then the patient they are choosing also, few patient they are not choosing, few patient they are choosing and they are getting the success also. And we are changing not like science is like a option is there in science, this is like a research only, nothing is more than that. We are doing research means sometime we will get success, sometime we will get failure. Failure means it not a end, it will again come another option, in that option we are getting success also.
So what is anti-vibration table and how will you use it, sir?
Anti-vibration table normally we are using for our ICSI machine. Anti-vibration table if you are using, normally here vibration is there, in that these gametes they are very sensitive. When we are doing ICSI, in that time we are using one needles, that needles when we are injecting and without anti-vibration table it will vibrate, means that gametes will be degenerate will happen and growth also it will less only. That's why we are using anti-vibration table for the gametes handling.
So what are laminar airflows and how are they used in this embryology lab?
Laminar airflow why you are using means when you are handling the gametes, that time some contamination will be happen, that avoid to cross contamination or contamination, that's why you are using laminar airflow every our procedures.
So what are the different types of incubators available at 39 and how are they used, sir?
Two types of incubator are there, one is box incubator, one is benchtop incubator. In box incubator, that is only uses for CO2 incubator, that one. Another one is benchtop incubator, which one you are using K system. In that we are using K system, Mink incubator is there, which one benchtop incubator. In that separate chamber is there. In separate chamber we are culturing separately one patient for one chamber only. If you are using separate chamber for separate patient, then it won't disturb for other patient also. When you are using X number of patient one number chamber, then you will culture Y number of patients 2 number chamber, Z number of patient 3 number chamber. If you are using one number chamber X patient, then it won't disturb for second and third patient. So that's why you are using that benchtop incubator.
So what is cryopreservation, sir?
Cryopreservation means whether you are going to do oocyte freezing or embryo freezing. Oocyte freezing means after pickup you are going to freeze the oocyte for future uses, and embryo freezing means day 3 or day 5, after day 3 or day 5 you are going to freeze the embryos for future embryo transfer, because on the some patient they don't want a fresh embryo transfer, or some patient having endometrium also not good. So in that case clinician they are suggested patient to you transfer after 1 month or 2 months. In that time we are freezing the embryos, that is called as a cryopreservation.
So in lab, how do you monitor how is the embryo development and what will be the stages during the embryo development, sir?
In our lab we are monitoring embryo development from 2pn, day 3, day 5, the stages also same only, 2pn, day 3 and day 5, and everything we are checking one by one, seeing we are culturing droplet culture we are doing, and we are checking single oocyte also, whether that is fertilized or not fertilized. If fertilized also, why it is arrested, everything we are checking the lab all day 1 to day 5.
So what are the different type of culture media and the role of culture media in this embryo development?
Two types of culture media is there. One is single step culture media, one is sequential culture media, another one is we are using Hafiz buffer media. So few lab they are using single step culture media, few lab they are using sequential culture media.
So what are the most common consumables used in the IVF lab?
Most common consumable like pickup needle, ET catheter, for embryo freezing, cryolock we are using, and culture media we are using, and disposable we are using like petri dish, tubes, all those things we are using in our embryo.
So, what are the basic measures you take to maintain the patient's confidentiality?
We are keeping with us very securely patient confidential. We are not sharing with any other one our patient details. That and we have a software. In that software where everything where storage the data. We are not sharing with the data to any other one.
So, what are the daily parameters that you check usually?
Daily parameter means morning we are doing after cleaning we are checking the incubator, the temperature, whether the temperature is correct or not, that CO2 gas is correct or not, after that cryogen and liquid nitrogen that level is correct or not, all those things, room temperature, humidity, everything we are checking daily.
So, what is benchmarking in IVF?
Benchmarking nowadays 40 to 50% is success rate in IVF FET cycle, and IUI 15 to 20%. In our lab around 65% is our success rate. In IUI around 18% is our success rate.